Hello, my name is Dr. Holly O, and I'm the Interim Chief Medical Officer of Yuvo Health.
Hi, I'm Tim Buxton. I'm the Associate Vice President for Risk Adjustment and Coding at Annova Solutions.
Hi, and I'm Sujata Bajaj, and I'm the Chief Technology Officer here at Yuvo Health. And with that, I'm handing this back off to Dr. O. Dr. O?
Thanks so much, Sue. I wanted to start our conversation by highlighting some clinical operation approaches that can support ACO arrangements. These type of approaches might be familiar to you already if you've tackled practice transformation journeys like PCMH, but they might be new to some practices. So the first is taking a population level view. ACOs, by definition, of course, are about caring for an attributed population, and taking a population view is different than one patient at a time, one visit at a time lens. And having the systems to identify subpopulations that can benefit from targeted support can really be fruitful in developing initiatives that will reliably and measurably improve outcomes and manage costs. So second, as I mentioned, since we're moving away from the one visit at a time sort of lens, optimizing processes outside of the exam room visit begin to gain additional importance. So for example, a really strong pre-visit planning process where, for example, a team member preps in advance of a visit to ensure that preventive care needs are identified and addressed in that visit. Or another example is care transitions programs. So patients recently discharged from the hospital get an outreach call from a nurse to ensure they have a follow-up appointment, clarity on their discharge instructions, access to their medications. These kinds of activities that happen outside of an exam room encounter can make the actual exam room encounter more productive. And also, it's really helpful to identify activities that don't require a provider visit, especially these days when provider staffing and access is such a universal challenge. Thirdly, you've heard me say optimizing the team to care for patients becomes essential in this work. And this may be a real adjustment for providers who are accustomed to shouldering the bulk of the responsibility. But it's a really important shift that with well-delineated roles and responsibilities, it can be great for the care of patients. It can also be really great for employee morale. And then finally, new focuses on coding and documentation. Now, we know that these two things sometimes are not favorite topics for providers to talk about, but they are important. And coding for risk adjustment is often a new approach, but at the end of the day, it's important for providers to know it really is just about getting credit for the good work that they're already doing, really capturing the complexity of that patient. Or in the realm of quality, documenting the care action that they're taking in a way that they get credit also becomes important. So while training is essential in these areas, tools to actually make coding and documentation easier at the point of care are equally as important. So these are all some big picture ways that clinical operations might need to shift to succeed in ACOs. And while change is hard, these shifts can really be beneficial for the care of patients and also for the experience of the care team. I'm going to turn the floor over to my colleague Tim to share a little bit more about operational perspectives of these.
Thank you, Dr. O. I just wanted today to touch on how we can help smooth out some of the differences and the new aspects of ACOs for clinicians and their staff, and in particular, talk a little bit about some of the work that we're doing at Annova Solutions in order to assist with these processes. First of all, enhanced coding, and Dr. O mentioned this. It is extremely important that coding be accurate, both diagnostic and procedural coding, so as to ensure, for example, payment integrity and to get a clear, accurate picture of the patient's health. Risk adjustment operations become significant, and risk adjustment diagnoses are those that CMS has identified as being chronic and particularly difficult, challenging, or costly to care for. It's extremely relevant that these diagnoses be properly documented and coded, so again, that they can be reported, that the patient's health can be understood overall. Lastly, when we think about quality measures, have patients have the vaccinations, cancer screenings, and such that they should be receiving, it's important to ensure, one, that those care requirements are met, but also that those items are properly documented in the medical record and reflected on claims or other data that's being submitted, so that, as Dr. O mentioned, the providers are receiving the credit that they should in that regard. And so when we think about addressing these things at Annova Solutions, there are a few approaches that we take in order to try to help with these situations. Firstly, that we apply analytics to look for potential missing diagnoses or gaps in care, looking for key patients whom we should target to try to make sure that their needs have been addressed. Secondly, the pre-visit planning or pre-visit record review that Dr. O spoke of. At Annova Solutions, we review the medical record before the patient's appointment so we can identify past conditions, conditions that are suggested by the documentation, as well as quality care gaps that haven't been addressed. And then that information can be presented to the provider before or at the time of the exam, the visit, so that the provider has that information and can more efficiently address these requirements and these needs. Thirdly, concurrent review, which involves reviewing the coding and the documentation, usually before the claim goes out the door, so that we can ensure that those items are accurate, and also that we give direct and immediate feedback to providers with respect to documentation requirements, what CMS is looking for, and so on. Our last element is outreach to the patients, calling, emailing, and other methods for reaching out to patients to ensure that they make it to their appointments, to speak to those who have transportation issues or otherwise miss appointments. And we want to make sure that these patients have their care gaps closed. We have a complete documentation of their health status and overall that their care is enhanced. So these are just some of the steps that we're taking to address the needs that Dr. O spoke of, some of the new elements that Dr. O spoke of. And I'd like to ask Sue to finish us up by discussing some technology solutions that speak to this situation.
Thank you, Tim. Thank you, Dr. O. So we covered the clinic optimization with Dr. O and the process optimization. And so now we'll talk about tech enablement of people and processes. And in that, we are really talking about data. So in order to, have good analytics, good pre-visit planning, really understand your patient population, you need to be able to have analytics. You need to be able to get to data. And to be able to get to that data, it's really connecting through interoperability to the HIEs. But more than that, more than just connecting to the exchanges, it's really being able to get that data and curate it. So being able to support and having an analytic solution that allows you to know who you need to bring in the door in terms of pre-visit planning, who you need to have concurrent review with, additional optimization around risk, quality, social determinants of health. You really need an interoperable solution. And the good news, CMS is, asking that for 2025 that folks have interoperable EHRs, which will really enable more data to come in. As many of you know, CMS sends you monthlies and they also have access to a weekly BCDA, but that's administrative data. That's really not going to get you what you need in terms of the rich patient longitudinal history as well. Another solution that is something that we're implementing here at Yuvo, as well as a point of care solution that allows providers to access, while a patient is in office, risk, quality, ADTs, et cetera, and that they can then leverage that information at the point of care, so that allows to enable pre-visit planning and actual review while the patient is in office. Lastly, there's a lot of discussion around AI and how to leverage it, but a tried and true AI methodology is really to apply that to natural language processing and be able to optimize reviews of historical data as well. So these are just three quick ways. Actually, they're not quick, but these are three quick hitters, I should say, heavy hitters that will really get you to optimization. And so with that, I would like to thank Dr. O and Tim for all their great insight around this. And we wish you well. Feel free to reach out to us, Yuvo Health, or Annova Solutions for additional recommendations and support. Thank you.